Howdy folks, Sam the Cell here again. I'm joined by my grandma as we explore what works in mHealth. We are off to our first location, Bangladesh. We are over the most dangerous highway in the world, the Dhaka Sylhet Highway. So grandma, traffic accidents are a serious problem here.
No need for that grandma stuff, girlie. Just call me Angie. And you're right. For every 2 deaths on the roads in the U.S., 160 deaths occur in Bangladesh.
Why is that?
Bangladesh doesn't have an emergency response system like 911. Less than 10% of ambulances are able to reach accidents.
So, Angie, how are you involved in this?
Well, let me tell you about my work with Critical Link. It's an app that uses text messages and phone calls to send the nearest responders who are trained in first aid and CPR to the scene.
That's amazing, Grandma.
What did I tell you about that grandma stuff? Let's get moving on to Thailand. I'm dying to try that pad Thai.
Angie, could you tell us about HIV and mHealth?
Here in Thailand, companies like Cell Life use text messages to encourage HIV testing.
But does it actually work?
Well, research has found that people who receive text messages are more likely to get tested for HIV. Cell Life also lets patients get results on their phones instead of having to go to the clinic.
Oh, let's get a move on.
Yeah, they're expecting us at our next stop. Here in South Africa, mHealth is used to remind HIV patients to take their medicines.
Oh, like VitaNet? It reminds people to take their meds, go to appointments, and look at lab results.
Yes, that's a good example. But have you heard of Simpill?
Is that another device that sends out medication reminders?
Yep. Simpill is programmed with the patient's schedule. If they don't take their medicines on time, they get sent a text message.
Can it work with all kinds of drugs?
Yes, like topical creams. And you can carry it with you.
Does it help people?
It was tested in Africa, and 94% of tuberculosis patients took their medicines on time.
That's great. Where to next?
We're off to Nigeria to talk about Ebola.
Do. We've arrived in Nigeria. How did cell phones help with the recent Ebola outbreak?
A social media campaign was used, along with an app to report suspected cases.
Wow, I didn't think you knew what social media was, Angie.
Well, Sammy, my girl, we have learned a thing or two over the last few years. Results were sent by text message, cutting reporting time by 75%.
It is amazing what happens when data and technology are put to good use.
Yes, it is. In 2010, 87 million Nigerians had a mobile plan, and now it's 131 million. Imagine the possibilities.
This has been great. Thanks for talking to us.
You're welcome, dearie. Here, have a cookie.
Yum, 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 yum. That's just a few examples of what works. Stay tuned for challenges in mHealth.